Let me give you a few tips on how to plan and prepare for getting one of the most complex implant dental procedure. And we're talking about the implant or teeth in a day, where we take all the teeth out, put implants in, and then give you a fixed temporary in the same day. One, you have to make sure that the dentist take a CT scan and a digital scan prior to surgery. That will help us design the surgery digitally, decide on the type of implant, the positions of the implant, and also make a 3D printed temporary. All this will help reduce the surgical time, also the extent of the surgery, which will allow for faster and better healing and less time and anesthesia and needles at the dental chair. Two, make sure that maybe it's a good idea to do one jaw at a time. Sometimes we can do 6 hours, 8 hours procedure, but if you can spread it out, it may be easier for you. So rather than having 8-hour procedure, maybe split them in 2 appointments 1 week apart. 3, make sure that you have the proper dietary instructions prior, during the procedure. On the first day, we would like to give our patients liquid diet and then soft diet thereafter. Remember, you have to keep soft diet during the entire healing of your implants. It's not just for the first week. No, you need to have a soft diet for the duration of the healing process. Think about it like if you have your hip replaced, you don't want to start running. You want to start slowly walking, and then eventually you're going to be able to run and eat whatever you want. So the first 2 months, it's probably a good idea to stick to a soft diet. 4, make sure that you have all the medications that you need taken care of before you go to the dental procedure. This way you don't have to go and search for the medication after. Tip number 5, if you can find someone like myself who's a board certified prosthodontist and have extensive training in the surgical aspects of the implant surgery. So this way you can get the teeth extraction, implant surgery, any bone graft that is needed, making the temporary, putting the final prosthesis, having in-house laboratory, all done in one place with one provider. That will give the procedure an easier process for you and will allow you to have better results and more attention to detail. So I hope this will help you make the most complex dental implant procedure easier for you. If you still have any question, please visit our website or subscribe to our YouTube channel for regular educational videos just like this one.
If you're getting value out of this video, please like and subscribe so we can reach out to more people like you.